This is for my patient Sabrina Fairchild. I don't have, unfortunately, my universal scaler. It was not within my packet when we picked it up for instrumentation. So I am going to be using my rigid 15, 16, 17, 18 for posterior for demonstration. I want to make sure that she does have, I placed her as moderate chronic periodontitis. She does have some tenacious calculus and some pieces. Fortunately, she doesn't have tooth number 2 to demonstrate, but I did place a piece on the distal of 4. So you would really want to make sure you're finding your correct working end. That obviously wasn't it. So I'm going to flip this, make sure that my shank is angled down, or my cutting end is angled down. I want to make sure I have a nice C shape. All of my fingers are connected with it. I want to make sure that I'm starting at the distal line angle. My palm is up when I go in. Distal line angle, I'm not too much on the lateral portion of the working end on that cutting edge. And I just want to go ahead and explore, even if it's subgingivally, and I want to start turning. So when I find that piece of calculus, because I'm using more of an exploring, I'm disrupting the bacteria, but I'm using more of an exploring stroke while I do that, so that once I find the calculus, I can put pressure and do a biting stroke to get that piece of calculus. So I would want to do that on the distals of all the posterior teeth. For this, because it is areas, surfaces towards me, I'd be straddled at 9 o'clock, or I would be parallel legged at 9 o'clock. If I was going on the inside, I would be, opposite sides or opposite surfaces, I would be at 11 o'clock. So there's that. I will go ahead and I will show you a demonstration. It's kind of tough to show you, but I would go ahead and I would do the distal of 4 as well. Start at the distal line angle, and again, wait until I find that piece and use lateral pressure and do a biting stroke. So if we are using our 1314, this is for the distal line angle, all the way, just demonstrating, not actually using it, distal line angle all the way to the direct of the mesial. So again, we want to make sure we're using a firm fulcrum. Our palm is up. So if I was on number 4, I would want to make sure that I'm going in. And with this, you can do kind of like you can do a sweeping stroke, horizontal really. You can kind of just use that lateral portion. You want to turn, turn, turn. And again, once you find that piece of calculus, you want to go ahead and place the working end under, firm pressure, and come up with that biting stroke. I'll demonstrate on this is obviously not the correct working end because the blade is, called it the blade, the cutting edge. We want to make sure that we're using our right working end. This is a little tough because this is number 32, but you want to go ahead and you can extend, and you just want to make sure that you're going in. You're using, I'm finger splitting a little bit because I don't have a really good fulcrum, and holding this at the same time. You kind of go across, and then you would pivot in, and you would want to make sure, I'm sorry that I'm not subgingival, all at the same time. And if you found a piece of calculus, you'd want to go ahead and do a stroke up. So there's that. I would also use my 7/8 for anterior. If I was working on the lower lingual facials, I would want to be sitting parallel legged at a 8 o'clock position, and I would want to, so areas towards me, I am going to find my correct working end. I'd start at the midline of the tooth. This I can go gingivally with, pardon me. And really when you start activating, you want to start turning right away. So you're doing this activating stroke, you're finding you're subgingivally exploring, and then you find calculus and you want a firm fulcrum, and you want to go ahead and do your biting stroke. So I would do that all the way across. And then if I was doing areas away, I would go ahead and switch to 12 o'clock. I'd roll around to 12 o'clock, make sure I have my correct working end. And same thing, I'd want to go ahead, start at the midline of the tooth, and right away when I'm activating, deplaquing, or getting calculus, I'd want to go ahead and start turning my instrument right away and doing that biting stroke away. That's really it. I would start obviously on the maxilla. I would start, if they had one, go around, deplaque on the inside, go on the bottom starting at 32, around, and so on and so forth. I would also really focus on the lower anteriors. I would use my anterior sickle for supragingival calculus, where you're really only using the toe. You're really not supposed to use the subgingivally. So I would go ahead, I would engage with the tooth at the midline. I'd be sitting at 12 o'clock, and I would just be using the toe of the instrument. And this one you really need to turn right away. Turn right away. And you're just really deplaquing. You're getting supragingival calculus right away. Again, for areas towards me, let's say that I can't hold a mirror right now, but I would be holding a mirror, and I would be sitting at 8 o'clock, and I would want to make sure I start at the midline, and I'm turning right away using the toe of the instrument. And then if the patient had stain, I really like my scoop instrument. And I know it's not technically called a scoop instrument, but that's what we call it in clinic. I would go ahead and I would use it primarily on the lower lingual teeth to get stain and really tough stain off. And then I would also use it for the lower facials, or even we've neglected these. If the maxillary facial lingual or facial teeth had a lot of stain, you just go ahead and you go across it. A lot of the other, like the Gracie curettes, are good for that as well. But that is how I would instrument this patient's mouth. Again, I can't demonstrate the universal curette because I do not have that, but I favor that instrument, and I would probably deplaque whatever I could or use it for calculus removal. So that is what I would do for this patient.